For my research project, I decided to do dementia. My grandfather was recently diagnosed like a few years ago, and I thought it would be a good opportunity to learn more about it. Okay, so what is dementia? According to the CDC, dementia is not a specific disease, but it's a rather general term for impaired ability to remember, think, or make decisions that interfere with doing everyday activities. Um, Like with heart disease, it covers a wide range of specific medical conditions, including Alzheimer's disease. Um, According to the Alzheimer's Association, disorders group under the general term dementia are caused by abnormal brain changes. These changes trigger a decline in thinking skills, cognitive abilities, severe enough to impair daily life and independent function. They also affect behavior, feelings, and relationships. The exact cause for dementia is unknown, but some types have direct causes, while others seem to appear like naturally. Um, there are some factors that can increase or decrease your risk, though. One being age, most cases affecting those 65 or older. Family history is another that can increase your risk for having it. Those who have parents or siblings with dementia are more likely to develop dementia themselves. Race is actually a factor, apparently. African Americans are twice more likely to have dementia than white people, and Hispanics are also 1.5 times more likely to have dementia than white people. Um, Poor heart health, such as high blood pressure, high cholesterol, and smoking, increase the risk of dementia. And traumatic brain injuries, such as head injuries, can also increase the risk of dementia. Some of the symptoms. The first most noticeable one was memory loss. However, memory loss by itself does not mean you have dementia. People with dementia have serious problems with two or more brain functions, such as memory and language. Although dementia is common in very elderly people, it is not part of normal aging. Um, Diagnosing dementia. To determine whether an adult has dementia, a healthcare professional will ask about the person's medical history, review the prescription and over the counter medication, supplements, and herbal and other remedies the person is taking. They'll also check for signs of depression and other mental or physical health problems that can cause dementia like symptoms. Um, they'll also ask questions about any noticeable changes in a person's physical and mental abilities, mood, personality, decision making, or behavior. Ask about possible delusions or hallucinations the older person may have had. Do tests of mental abilities, including attention, memory, thinking, language, and decision making skills. They'll also complete a physical exam that includes blood and other lab tests to check for underlying problems and reversible causes such as infections, vitamin B deficiency, thyroid problems, and possibly recommend brain scans to look for abnormalities such as brain tumors and evidence of changes that are linked to dementia. There's several types of dementia. Alzheimer is a type. The trademark symptom is trouble remembering recent events, such as a conversation that occurred minutes or hours ago. And with this type, family history is the most important risk factor. Having a first degree relative with Alzheimer's increases the risk developing by 10 to 30%. Vascular dementia accounts for about 10% of dementia cases and are linked to strokes or other issues with blood flow to the brain. Um, the disease progresses in a stepwise fashion, meaning symptoms will suddenly get worse as the individual gets more strokes or mini strokes. Lewy body dementia is more aligned with more typical symptoms like memory loss. People with this form of dementia may have had movement or balance problems like stiffness or trembling. They also might experience mental delays, including daytime sleepiness, confusion, or staring spells. They might also have trouble sleeping at night and have hallucinations. Frontal temporal dementia is also another type, and it most often leads to changes in personality and behavior because of the part of the brain it affects. They might embarrass themselves or behave inappropriately. Um, and mixed dementia sometimes occurs in which more than one type of dementia is present in the brain at a time. Especially this occurs especially in people aged 80 or older. Um, Disease progression may be faster with this kind of dementia. Another kind of dementia could be caused by reversible causes. People who have dementia may have a reversible underlying cause, such as side effects of a medication, increase in increased pressure in the brain, vitamin deficiency, and thyroid hormone imbalance. Um, Medical providers usually screen for reversible causes in patients who are concerned for dementia. Many people who have dementia are oblivious to the results that it has on their mental capacity. Sadly, dementia permanently robs patients of their minds and prevents them from functioning adequately in their environment. It tends to deprive patients of their dignity and independence in the end, too. Treatments. Dementia is not curable, and but depending on the kind you have, it is possible to prevent the disease from progressing. Um, like, for example, if dementia is a result of hypertension, adequate control of this condition may prevent further brain damage. Um, Also, the prevalence of vascular dementia is decreasing in countries where efforts to reduce cardiovascular diseases have been successful. Um, like another example is if dementia is a result of blood clots reaching the brain, um, then anticoagulants or aspirins may be recommended. Um, For physicians, an important aspect of diagnosing patients with dementia is detecting potentially reversible causes that may be responsible for the impaired mental functions. A detailed history, meticulous clinical examination, and a few selected laboratory tests are usually sufficient to reach a diagnosis. A lot of various investigators have also estimated reversible causes of dementia can be identified in 9 to 23% of patients, and they recommend CT scans, a complete blood count, and test of erythrocyte rate, blood glucose, serum electrolytes, serum calcium, liver function, thyroid function, and serum B12 and folate. Some investigators also recommend a routine testing for syphilis, which surprisingly is actually one of the causes of a type of dementia. New treatments. Um, like I said, dementia is not curable, but there has been recent research on ways to like better the well-being of the patients. So the National Center for Complementary and Integrative Health states that despite there being no cure, many preliminary studies of some mind and body practices, such as music therapy, suggest that they may be helpful for some of the symptoms related to dementia, such as agitation and depression. In fact, several studies on music therapy in people with Alzheimer's disease have shown improvement in agitation, depression, and quality of life. Mindfulness-based stress reduction programs may be helpful in reducing stress among caregivers of patients with dementia. And this is basically the only real new research that I found intriguing. And this is my works cited. And that's it.